Yeah, it's a great question, and we've got a fair amount of research in the past on this. And I would say we probably look at this a little bit differently than other organizations. So uh, my background, for instance, started in clinical psychology, and then I went to Stanford for med school and got interested in well-being, and now have really been involved with a lot of organizational psychologists. And this is probably what makes our view a little bit different than some of the other approaches to resident well-being and burnout. So we have engaged a large number of organizational psychologists, in particular our Physician Wellness Research Lab out of Claremont Graduate University, led by Dr. Jason Siegel, but also a number of other experts in this field, Dr. Rich Ryan, Scott Rigby, Adam Neufeld. And what the difference is here is that as a clinical psychologist, I'm looking at burnout maybe as an individual factor problem. And as an organizational psychologist, we look at it more as what's going on in the environment. So when we look at this, we look at it through the lens of a couple of really important theories. So job demand resource theory, which the American Medical Association has adopted, and it's a nice theory in terms of workplace burnout. And then self-determination theory, which is an organizational well-being theory that we believe is probably the most well-researched. So when you look at burnout this way, we see it a little differently than many others. We see it as how does the environment create the situations that would lead to burnout or well-being. And so what we have found in our research is that there are 5 pillars that really can predict the majority of workplace burnout for residents. And these come from this organizational psychology lens. So the first one is job demands themselves. So how many job demands versus the resources, or what we would call the efficiency of practice. So can you make the practice just as efficient as possible? That's probably the most pronounced driver for resident burnout. But then there's the 3 basic psychological needs using self-determination theory language. And these are needs that all of us have at work, whether you're a resident or attending or anybody else. And they are autonomy, belonging, and competence. And so does the environment support the perception of psychological autonomy, belonging, and competence? And that predicts another bunch of the variants in burnout. And then the last one, interestingly, is does the environment support a sense of meaningful work? So a lot of times leaders think that's an outcome that they don't have much influence on. But in fact, we found that identifying, amplifying, reflecting back meaning is a profound variable that we can use to help with workplace burnout. So we did a study last year with 2,029 residents, and we could predict the vast majority of workplace burnout with those 5 things: autonomy, belonging, competence, meaning, and job demand to resource or efficiency of practice. And we just replicated it again. Last year, we used the Professional Fulfillment Index. This year, we used the AMA's Mini-Z or Mini-Res-Z and found the same thing. So from our standpoint, looking at this from an organizational psychology standpoint, it is, does the environment support autonomy, belonging, competence, deep meaning, and efficiency of practice?